Hi, everybody. My name is Julia,
And my name is Gloria.
and we're speaking on behalf of Students for Herd Immunity, which is an organization started by a group of professors and students from Harvard University, which aim to disseminate accurate, age appropriate, and culturally relevant information about COVID 19 vaccines as a pivotal step to ending the COVID 19 pandemic.
So we have posters of many languages for different age categories about COVID-19 in our description. So please take a look at it. Feel free to download it and share it. We've already had multiple cities distribute these posters.
In today's presentation, some of the topics we'll be going over are listed here so you can take a quick look.
Starting from the beginning, in 2019, the first outbreak was in Wuhan, China, in wet markets, which is a place where meats are sold. So those markets aren't necessarily sanitary, so there's a lot of cross-contamination. So there is a myth that coronavirus was contaminated from bats, but there was no evidence that bats were sold during the time of the outbreak. Instead, professionals shifted their suspect to pangolins, which were illegally sold in wet markets in China. They are also found with coronaviruses much similar to the severe acute respiratory syndrome coronavirus 2. So in Canada, we had 3 waves. Specifically in this graph, it shows the cases of Ontario. Currently, we're still in the 3rd wave, but the new cases each day are decreasing exponentially with the help of lockdowns and the increase in vaccinations. There are many names for COVID-19. There is a novel coronavirus, COVID-19, or severe acute respiratory syndrome coronavirus 2. There is a difference, and they are very different, and they are used for different reasons. Novel coronavirus just means new virus, so it was used more towards the beginning of the pandemic. So novel means new or unknown, and coronaviruses are any virus that causes respiratory, gastrointestinal, and neurological diseases. The common cold is even a coronavirus. COVID-19 is a name for the disease. It was classified by WHO to refer to the disease response, prevention, treatment, severity, and more. Severe acute respiratory syndrome coronavirus 2 is the name of the actual virus. It is called that because it is generally similar to the older epidemic called SARS in 2002.
So now I'm going to talk about what is herd immunity. When someone is vaccinated, they're very likely to be protected against the targeted disease, but not everybody can be vaccinated. People with underlying health conditions that weaken their immune systems, such as cancer or HIV, or who have severe allergies to some of the components used in vaccines, may not be able to get vaccinated. So these people can still be protected if they live among other people who have been vaccinated. And when a lot of people in a community have been vaccinated, the pathogen has a hard time circulating because most of the people it encounters are immune. The more the others are vaccinated, the less likely people who are unable to be protected by vaccines are at risk of even being exposed to the harmful pathogens. And this is called herd immunity. And this is especially important for those people who not only can't be vaccinated, but may be more susceptible to the diseases because no single vaccine provides 100% protection, and herd immunity does not provide full protection to those who cannot be safely vaccinated. But these people will have substantial protection thanks to those around them being vaccinated. As well, to be able to successfully and safely immunize people, lockdowns are still a requirement to minimize deaths.
Let's talk about your immune system. So there are 3 vocabulary you do need to know. So the immune system is a system of organs that work together to protect the body from foreign invaders. Those foreign invaders are called pathogens, which are bacterium, viruses, parasites, or fungus that can cause the disease within the body. And another word is antibodies. They are proteins that learn to recognize foreign invaders of the body, then they work with the immune system to destroy these invaders. So when the human body is exposed to an antigen for the first time, it takes time for the immune system to respond and produce antibodies to the specific antigen to beat the pathogen and to take the foreign invaders and basically destroy them. So then there is the second time or in the future when you get the pathogen again. So your immune system will be able to respond much more immediately and protect against the disease because the antibodies in your body already recognize that specific pathogen or antigen.
So now I'll be talking a little bit about how the COVID-19 vaccine works. Coronaviruses, like the one that causes COVID-19, are named for their crown-like spikes on their surface, which are these things shown on this little icon over here, and they're called spike proteins. These spike proteins are ideal targets for vaccines. Vaccines contain weakened or inactive parts of a particular organism or an antigen that triggers an immune response within the body. Newer vaccines contain a blueprint for producing antigens rather than the antigen itself. Regardless of whether the vaccine is made up of the antigen itself or the blueprint, so that the body will produce the antigen, the weakened version will not cause the disease in the person receiving the vaccine, but it will prompt their immune system to respond much as it would have on its first reaction to the actual pathogen. And why is the COVID vaccine given in multiple shots? So this is because time is needed for the production of long-lived antibodies and the development of memory cells. So when vaccines are given in multiple doses, the body is trained to fight the specific disease-causing organism, building up memory of the pathogen so as to rapidly fight it when exposed in the future.
So types of vaccines. So mRNA are a single-stranded genetic code in the body. So mRNA vaccines teach our cells to make a protein that will trigger an immune response without using the live virus that causes COVID-19. Once triggered, our body then makes antibodies. These antibodies help us fight the infection in the real virus if the real virus does enter our body in the future. So RNA stands for ribonucleic acid, which is a molecule that provides cells with instructions for making proteins. So in conclusion, the mRNA in the vaccine teaches your cells how to make copies of the spike protein. If you are exposed to real viruses later, your body will recognize it and know how to fight it off. Adenovirus is a code and blueprint to help your body produce the spike protein. So there are vector and vessels that carry the DNA into your body. This is the weakened form of the virus and cannot replicate in your body. It uses a very similar process with mRNA to teach your body to build a strong immune response against the spike protein without exposing you to the virus that causes COVID-19.
So here I have a table of the 3 FDA-approved vaccines, which also happen to be the 3 most common vaccines administered in Canada. So firstly, Pfizer and Moderna, they are mRNA vaccines as discussed by Gloria, and Johnson & Johnson has the adenovirus vaccine. It is important to note that over here, the overall efficacy rates. So when you look at these numbers next to each other, it's natural to conclude that one of them is considerably worse. So why would you go for a 66% efficacy rate when you have 95 and 94% options available? But this is actually not the right way to understand a vaccine's efficacy rate or even to understand what a vaccine does. So the reason for this is because these clinical trials that produced these numbers are not conducted in the same ways. For example, the Johnson & Johnson vaccine was tested during one of the most severe stages of the pandemic, where transmission cases and hospitalizations were at their worst in many places around the world. And this trial also captured efficacy against the new variants of the virus, SARS-CoV-2, which began circulating at the time when the trial was conducted. And several of these variants have actually been shown to be more contagious, deadlier, and even more likely to evade protection from vaccines and prior immunity. Also, the Johnson efficacy results included trials in other countries, whereas the results for Pfizer and Moderna were mainly from US-based participants. So in all, it's very misleading to only look at these numbers, and you really shouldn't compare or judge a vaccine's protection that it provides just looking at these numbers.
So let's talk about post vaccination. Firstly, side effects. Some may experience side effects, some may not, and both are completely normal. And if you do have side effects, this is because your immune system is instructing your body to react in certain ways. It increases blood flow so more immune cells can circulate, and it raises your body temperature in order to kill the virus. But that doesn't mean if you do not have the side effects that your body isn't working to kill the virus. It just depends on the person and how they respond and how sensitive their immune system are. So the most commonly reported side effects are like tiredness, pain in the injection site, headache, muscle pain, chills, joint pain, fever, and diarrhea. But having more severe side effects are a little bit more concerning. You would have to go to your closest health clinic and talk to them about it. And one of the most severe or more severe side effects that you can have is an allergic reaction. Let's talk about wearing a mask. Do I have to wear a mask after vaccination? Yes, you definitely have to do. To build immunity, you have to wait until the vaccine is injected inside you and then let your body try to attack and kill the virus, and that will take around 2 weeks. So once you get your second dose, you have to wait 2 more weeks for you to be completely vaccinated. And because of that, you would still need to wear the mask. And even if you have all the vaccines and you're already 2 weeks after your second dose, it's still best if you do wear a mask, since remember, there's not a 100% chance rate in terms of not getting the COVID-19, even though effective the efficiency of the vaccine is very high. We are still learning many things. Scientists are still learning how well vaccines prevent you from spreading the virus. Although COVID-19 vaccines are effective in keeping us from getting sick, scientists are still learning if vaccines prevent you from spreading the virus. We're also learning how long COVID-19 vaccines protect people. Remember that these new vaccines are different from our traditional vaccines, as traditional vaccines usually take 10 years to be produced. For these reasons, people who have been fully vaccinated against COVID-19, of course, still take precautions and wear masks indoor, public places, avoid large indoor gatherings, and wash your hands very often.
So now I will be addressing one of the concerns that I know most of you might have, which is virus variants. So most viral mutations have little to no impact on the virus's ability to cause infections and disease, but depending on where the changes are located on the virus genetic material, they may affect a virus properties, such as transmission. For example, it may be it may spread more easily or less easily, or severity. For example, it may cause more or less severe diseases. The COVID-19 vaccines that are currently available provide at least some protection against new virus variants because these vaccines elicit a broad immune response involving a range of antibodies and cells. Therefore, changes or mutations in the virus should not make vaccines completely ineffective. In the event that any of these vaccines prove to be less effective against one or more variants, it will be possible to change the composition of the vaccines to provide against these variants. And data continues to be collected and analyzed on new variants of the COVID-19 virus. The WHO is working with researchers, health officials, and scientists to understand how these variants affect the virus's behavior, including their impact on the effectiveness of vaccines. That being said, stopping the spread at the source still remains key. Current measures to reduce transmission, including hand washing, wearing a mask, physical distancing, good ventilation, avoiding crowded places, they still continue to work against new variants by reducing the amount of viral transmission, therefore also reducing opportunities for the virus to mutate.
COVID-19 vaccines for kids and teens. So youth between 12 and 17 years of age and their family members who have not received a vaccine will be eligible to book an appointment for their first dose of Pfizer vaccine at mass immunization clinics beginning the week of May 31st. Public health units may choose to provide vaccines to youth 12 and over earlier, where the Pfizer vaccine is offered. Pfizer is 100% effective in children, and for the longest time, Pfizer has been testing the vaccine for younger age groups. So why are we vaccinating kids and teens when they're low risk instead of giving second doses to the people who are more vulnerable? There is a lot of scientific evidence that demonstrate that it's important for young people to be vaccinated as well in order to reduce community spread. As vaccine supply improves across the country, professionals also expect that most seniors won't have to wait the whole 4 months. The exact timing will depend on which province or territory you live in, though. So now we'll be busting some myths, and the first myth I'll be talking about is I can get COVID-19 from the COVID-19 vaccine. No, this is absolutely false. You cannot. You are not even having the COVID-19 virus injected in you. Whether it is dead or not, it is completely not COVID-19. What happens is, as we explained before, it is mRNA. It is a genetic code that teaches your body to create something that is kind of similar to COVID-19, but is completely harmless, even if your body cannot fight against the fake virus that your body has produced through the genetic code. It will be completely harmless to you. Your body may think it's being attacked. Well, it is not. So you can rest assured it is completely safe.
Another common myth about the COVID vaccine is that they were developed too quickly for it to be safe. Well, this is actually not true. COVID vaccines are developed quickly, but without any compromise to the safety or scientific integrity. Prior research on mRNA vaccines, enormous research budgets, and large amounts of willing trial participants contributed to this speed. Lastly, another misconception is that the COVID vaccine can cause infertility, cancer, autism, or any other devastating disease. In fact, there has been no documented cases of the COVID-19 vaccine causing any devastating diseases. False stories are quickly circulated around social media that perpetuates these myths. Not getting a COVID vaccine, however, can have serious consequences.
Please do your part to support herd immunization, as this is the critical stage in where your choices and our choices matter to end this pandemic. You can look at the link to get your appointment now in your province. Note that this is only for Canada. The link will also be available in the description below. So these are the sources we use for the presentation, so feel free to check out these reputable sources yourself if you have any concerns.
Thank you so much for watching this video brought to you by two representatives of Students for Herd Immunity. If you have any questions, feel free to leave a comment in below, and we will do our best to respond right away.